Secondary effects, the shadow consequences of injury. Patients often experience a cascade of non-physical issues and search for their relevance to a claim. Welcome, I am Dr. Gurpreet Pata, situated here at Injury Experts, located at 4477 Woodson Road, Suite 103 in Woodson Terrace, Missouri, right next to Lambert St. Louis Airport. If you are watching this, you have likely realized that a physical injury is not just a single event in your life. It is a biological and economic pivot point. Most physicians focus on the visible fracture or the herniated disc on an MRI, but today we are looking at the shadow, the secondary effects of injury that insurance adjusters want to ignore. To minimize the value of your claim, we are performing a forensic audit on the psychological sequelae, the social determinants of failure, and the systematic erosion of your enjoyment of life. The science of the shadow injury. We reject the medical assembly line model, which treats patients like mechanical parts. If you are struggling with PTSD or anxiety following an accident, you do not have a willpower problem. You have a neuroinflammatory data problem. Significant research documents how traumatic stress triggers a systemic release of pro-inflammatory cytokines. These molecules act like chemical gasoline, lowering your pain threshold. The insurance industrial complex wants to silo your mental health, but a broken mind and a broken body are fueled by the same metabolic fire, the social cost of silence. Let us be analytical about the economics. An injury is a thief of generational wealth. It comes with the risk of homelessness. A landmark study in JAMA surgery by Malhotra and colleagues quantified the 3-year labor market consequences. Survivors face massive annualized income loss. If you settle your claim today for the cost of a surgery, you are ignoring the compounding interest of a life you can no longer lead. Marital strain makes productivity loss 2/3 more likely. Medical debt is not just a financial problem, it is a biological stressor. High cortisol environments driven by financial desperation actively prevent your tissue from healing. Adjusters delay the process, waiting for your bank account to hit zero so you will accept a low-ball settlement. It is a predatory strike on your sovereignty. The loss of enjoyment of life. The medical assembly line calls this subjective, but at our center we treat it as data. Loneliness and isolation are physiological stressors. When your injury keeps you from your church or your friends, your metabolism begins to fail. 79% of fibromyalgia patients show signs of insulin resistance. An injection in a toxic terrain is just a temporary bandage. We focus on fixing the biological soil by addressing your sleep, movement, and nervous system regulation. The Edwards study and the malingering label. A significant fear is being accused of malingering, but functional neurological disorder is not feigning or malingering. We refute these claims using objective physical findings. A diagnostic block is a physiological audit. It proves the pain circuit exists as an immutable fact. The contrarian viewpoint, treating chronic pain with opioids without fixing the metabolism, is like silencing a smoke alarm while the house burns down. We are witnessing a systemic collapse where only 12% of us are metabolically healthy. We are an endangered species living in a broken model. Don't let a corporate spreadsheet dictate the value of your life. Identify the signal, fix the terrain, and reclaim your future. Connect with Dr. Pata. Text us at 314-886-5902 or visit concussion.center. Stop being a victim of a broken system and become the clinical commander of your own recovery.